How does alexithymia make identifying emotions hard for autism? Imagine trying to understand a language you've never learned. That's how it can feel for some autistic people with alexithymia when they try to recognize their own feelings. Alexithymia is a condition where people find it hard to identify and describe what they are feeling inside. It's quite common among autistic individuals, with about 40 to 65% experiencing it. This means many autistic people struggle to know exactly what emotions they are experiencing at any moment. At its core, alexithymia involves three main issues. First, it's hard to tell what feelings are happening inside. Second, it's difficult to put those feelings into words and explain them to others. Third, people with alexithymia tend to focus more on external things around them rather than their internal emotional states. So, when an autistic person feels upset or anxious, they might sense something is wrong physically, like a racing heart or stomach ache. But they might not be able to connect those physical signs to feelings like anger or sadness. This makes it hard to understand what's going on inside. Because of this, recognizing emotions becomes a challenge. Without knowing what they are feeling, it's tough to respond in a calm and appropriate way. This can lead to emotional outbursts or withdrawal because they don't understand what's happening or how to manage it. It also impacts social skills. Emotions are a big part of how we communicate with others. If someone can't identify their own feelings, they might find it hard to read others' emotions or respond correctly. This can make social interactions more confusing and sometimes lead to misunderstandings. Unrecognized emotions can also show up as behaviors that others might see as unusual. For example, someone might become quiet or act out because they're overwhelmed but don't know how to express what they're feeling. Having alexithymia can also increase the risk of mental health issues like anxiety and depression. When feelings aren't understood or processed well, it can make mood problems worse. That's why many therapies focus on helping autistic people build emotional awareness. Therapies like cognitive behavioral therapy or emotional regulation training can teach skills to recognize physical signs of feelings. For example, noticing a tense stomach might help identify anxiety. Learning to label these sensations makes it easier to understand and communicate feelings. In the end, alexithymia makes it hard for autistic individuals to recognize, understand, and describe their emotions. This can make emotional regulation and social skills more difficult. But with targeted support and practice, they can learn to better identify their feelings, which helps them feel more in control and connected with others.